Welcome to the Rainmaker Multiplier on Demand, a podcast for leading financial professionals, or rainmakers, and their teams that offer support for securing a successful future. From marketing help to staffing structure, listen and subscribe for actionable insights from advisors and skilled professionals alike.
Hi, I'm Kirsten Schlumbohm, Vice President and Head of Annuity Sales here at C2P. I'm really excited to have our guest, Rebecca Bloom, on the Rainmaker Multiplier podcast. Last week, I was actually talking with my personal trainer regarding the subject about women taking care of themselves as their health is their wealth. So I feel like this is very timely. So I would love to introduce Rebecca Bloom, author and founder of When Women Get Sick. She is a patient and workplace advocate with over 25 years of experience helping women navigate the complexities of serious illnesses in the healthcare system and workplace. A former workplace benefits attorney, she provides practical advice and resources based on both personal and professional expertise. As a writer, editor, and content strategist, Rebecca collaborates with individuals and organizations to craft impactful stories, campaigns, and projects that inspire and empower. So welcome, Rebecca. I'm so excited to have you here.
Thank you so much. It's so nice to see you.
It's so nice to see you. Can you share with us your story? Because I find it so fascinating. You've been in this business. You've been helping women take care of themselves. So you have some history as a retirement lawyer. So what brought you to where you are today for advocating for women's health?
Sure. So it's interesting, right? Being an employee benefits lawyer was my business. It was my first kind of out of the box, out of law school, professional endeavor. And what I learned through watching what employers do in the workplace for their employees is that this is a complicated relationship, right? The employment relationship is super complicated and it's not as holistic as it needs to be, but there is a lot of burden on employers to kind of fill in the safety net for people, right? Because the government safety net only goes so far. And what I learned is it's really complicated. You know, there's health insurance, there's life insurance, there's all kinds of other employee benefits that are brought to bear in this relationship. And then what happens when somebody becomes disabled or sick is things go off the rails and they get complicated. Like I learned from doing big corporate transactions that really the question gets asked, who takes the employees that are on disability? Is it the purchaser or is it the company that is, being purchased? Who keeps them? Who takes them? As you know, and it's so complicated because we're talking about human beings here who are on health journeys, right? So what I learned was it'd be really hard for any one human to help another one when they're on one of these health journeys if they're not armed with a really holistic idea of what it means to take care of someone else. And strangely enough, corporate America is the one that taught me that lesson of just how many layers there are, how complicated it is, what questions need to be asked, and, kind of keeping the human in human resources, if you will.
That's a tough one because things change so fast.
Yeah, but that's how I got to it. And then my mom was diagnosed with breast cancer shortly after I left my law firm. And I was doing other things, consulting for other attorneys, helping, sort of helping people get divorced, helping them split their pensions up, things like that, that were, really complicated and nitty gritty, but not really that fulfilling in a lot of ways. And then I saw it with my own two eyes. My mother, who had, my dad, who was employed and had health insurance, I saw still how complicated this journey became for her and what I could do to help her smooth it. And that's when I had an aha moment that I could take all these things that I learned and I could help women in a really significant, important way because I was armed with these very specific kind of benefits goggles to help somebody think about what they do when they have to interface with this system.
Well, first of all, thank you for sharing about your mother. I'm sorry that you went through that with her, but we're very grateful for your expertise because of what you went through. A lot of times we don't understand systems or processes until we're in the thick of it. But thank you for sharing that. And your mom is okay?
She is. She
Fabulous.
is. Yeah,
Fabulous.
she is.
I'm
And
glad. I'm glad.
what a journey. But yes. And thank you. Thank you.
Women financial advisors, especially those who run their own firms, still face the same challenges every other woman does when it comes to our healthcare system and the barriers. What are some of these challenges that you have found women that they face when they need medical attention?
So that's such a great and complicated question. And I just want to break it down a little bit because the challenges start sort of from far away. Women are under researched. Women tend to be financially under resourced compared to men. So there's that. And there's also these baked in biases, right? Women are hysterical. Women's pain is overestimated. I don't know if you saw, but there was this podcast called The Retrievals that was on the New York Times. And it basically showed it was really a crazy thing. Like a nurse stole the fentanyl, and then these women were put through IVF retrievals without pain medication, and people didn't believe them when they said they were in pain. It was nuts. But you should go listen to it. It's crazy. I know you said you like listening to audiobooks. You should go listen to that podcast.
I'm writing it down.
Yeah. And then just recently, I think yesterday, I read an article about the fact that we now have proof that the pain medication that we think is supposed to work doesn't work as well on women. And again, all of that is backed up from the fact that things weren't researched. So those are sort of these systemic historical barriers. And then you have the day-to-day ones. Just access to care is so hard. Figuring out the complexity of who's covered, what's covered, who can I talk to, when can I get an appointment, why do I have to wait 9 months? All these things, they all, and the other thing is that women are the historical caretakers, and they're going to be the ones who are much more likely to put everybody else first.
Mhm.
So all of these things kind of create this, I call it an imperfect storm, not a perfect storm, around keeping women from getting the care that they need.
And women are the caretakers. We will put ourselves last. It's
Right.
it's a known fact when you look at like healthcare statistics or you look at long-term care statistics, who takes care of the caretaker when there is an event.
Absolutely.
Why do you feel the current system is set in the way where women are struggling to find proper medical support and feel seen, or we really don't feel seen or heard by the providers? What's wrong?
So many things are wrong. I call it the medical industrial complex. And, there's just there's so much greed. There's so many stakeholders coming from different places. There's startups that made this app that has to be used and that gets paid for, and everything. All of that gets heaped upon the consumer. And there's so many things going on behind the curtain that we don't see because the system is running on dollars instead of healing purpose. And when you really go back in time, the system was not built for women. So all the advocating that I've been doing it's now over 26 years, is around the fact that we have to find these solutions to link arms and take care of one another and communicate better and advocate better inside of a system that wasn't built for women. If we could start over, that'd be great.
Or we could take a sledgehammer to it. We could rebuild it, but unfortunately,
Sure.
we're advocating what we have and the barriers that we have to overcome.
That's right. But I think that's the main reason why. I mean, like I said, it's super complicated, and you got this hand over hand over hand thing of, even a fix created new incentives, and then a different fix created different incentives. But, sort of at its root is that women's wellness has not been prioritized.
Well, I'm glad you're here to advocate with us for women's health being a priority, because in a career in financial services, it can be a high stress job.
Sure.
You're in it, I'm in it. It can be high stress, but it doesn't define who we are. How can an advisor or a female advisor or even a female not in the business advocate for themselves so that when they are in a medical situation or they're having an event, that they get the legitimate care that they need? And it's not just stress. It's not just, oh, you're stressed out. Go to the spa and take care of yourself. What can we
Yeah.
do to be better advocates, I guess, is the moral of the
Yeah.
question.
So I have a developed view on this topic, and it starts with preparation. And so that's hard, right? Because anytime you get a diagnosis, you're not expecting it. So how could you prepare for that, right? I mean, feels like a little bit of a Gordian knot. But the thing is, you can. As soon as you know that you're facing something, one of the first things I recommend is do some pre-reach outs, do some communicating with HR, with the right person in the hospital system, with the administrator of the medical office that's your first line in, and speak to people before you need something. So I mean, this sounds simple, but people never think of it. I always tell people, send the email saying, hey, this is who I am. I'm embarking on this health journey. It would be so wonderful if I knew that I could reach out to you when and if I hit an impasse. And you would be so surprised. People love to hear from you when you don't actually need something, when you're just being friendly and kind and respectful. And then the next time they get your email, you're not a stranger. They might even say, here's my phone number, send me a text. You'd be so surprised how well this paves the way. So that's one thing, the preparation. The second thing, and this is a very big deal, and I tell every woman, whether it doesn't matter whether you're the CEO or you're working in a low wage job, it's the same thing. Build a team, draft a team for yourself. Don't do this alone. No woman should ever do this alone. And we all have people in our lives who are really actually well suited to be on our healthcare team. You know, if you write a book like I just did and you're launching it, you don't hesitate to go, I need a launch team. And you circle up the wagons. People don't do this when they're on health journeys because there's shame and there's fear and there's, embarrassment. People don't know how to handle this. And executive women in financial services, particularly, that's true. The brave face and all that. Draft a team. Your friend who's a lawyer is probably the right person to help you every time you get a bad bill. Your friend who's an accountant or a project manager is probably the person who should keep a notebook of all those bills that you get and all those explanations of benefits and all those things that you get that give you a headache that you don't want to deal with. Let that person handle it. I always say you probably don't need another lasagna in the freezer as much as you need somebody to keep that notebook for you, right? So again, you've got a neighbor who's going to help you drive the carpools. You have all these things, but it'd be great if you thought about it like an org chart. Think about it like you would at work, right? Pick a chief of staff and give that person a clipboard and a whistle and let them handle controlling the rest of the team and making all those decisions and parceling out the tasks so you can focus on your healing. That's a big deal.
That's a huge deal. And in my head, I'm like, we're really good at networking. I want to grow my business. I want to grow my volunteer base. I want to do X, Y, Z. So I network.
Right.
It's what I want. But if I want to be healthy and I'm going through a life event or I'm going through a health event, why wouldn't I apply the same strategy? Except for
Totally.
fear or embarrassment. I am a private person. Maybe I don't want everyone to know what I'm going through. But without as the kids say today, their squad, you're not going to navigate it as well. So I love that because we do it in our jobs every single day. We do it as the CFO of our family household. Why wouldn't we do it for our health?
Exactly. We have the skills. They're available to us. And, on the larger level, what's that really about? It's about using your community. It's about, kind of giving people an opportunity to give back to you because you've given to them. And people don't think about it that way. But really, most people are so happy to do something for you, because look at all the things you do for them, right?
Well, it's so interesting and fascinating because what you just said, I will jump and help people because I can. However, when it comes to myself, I keep it private between my husband and I and our immediate family.
Yeah.
But why wouldn't I lean on those that I trust and I know will support me? It's that way we think of I have to take care of it all. I was told I can, have it all, but I have to do it all.
Totally. And not only that, we're in the middle of a profound loneliness epidemic, right?
Mhm.
And people want to feel connected to one another. COVID functioned to have us lose most of our loose ties. And loose ties are actually the way we get things done in the world. That's how you get jobs. That's how, you connect with people outside of your smaller circle. And this is an opportunity to connect. People want to connect. People need to connect.
And people connect when it comes to fundraising or other opportunities, but just not for themselves. So that's going to parlay us into talking more about your book because I'm July 29th is when the hardcover launches, and I'm super excited because it's on my list now to read. But your book, When Women Get Sick, dives into how women can navigate our complicated healthcare system. It's very complicated
Yeah.
and get the support they need. Can you share a few more tips on how women can get the most out of the system and where do they start? Because I think that's part of it too, analysis paralysis. And I'm overwhelmed. Where do I start? How do I
Yeah.
start?
Yeah. Well, so where I start in my book, in each chapter, is with stories, because women need stories. We're the culture keepers. And through these stories, I illustrate so many principles of how to do this, whether it's don't freak out when you get this big bill, whether it's what do you do when you thought your medication was going to be waiting at the pharmacy, but your friend goes to pick it up and it isn't there because they don't have it in stock. What do you have to, how do you deal with these little moments, right? Um, there's a lot of tips. There's a lot of takeaways. In fact, each chapter after the story and after illustrating what those principles are has a list of tips and takeaways. How to shop for the right insurance policy to begin with, how to communicate with doctors. That is a huge thing. I want to say that. That's a tip I want to give. Most doctors can't stand the electronic health records. They hate them just as much as we do. And some of them, they don't have time for this. It's like checking Facebook at the end of the day. It becomes another part of the job. As it is, they have to take notes while they're treating you and put those notes into the system. They've got those 12 minutes or whatever it is for that appointment, and that's included in that. You know, ask your doctor, how would they like you to communicate with them? That is a huge tip. Every doctor I interviewed, and I interviewed a lot, said that. Please don't just assume that you have to send me a message in the portal and that I have 48 hours to answer it. Ask me, because it might be that I'm going to tell you, call the woman who works at my desk and she's going to get in touch with me and I'm going to call you on my break. Or she's going to give me your message and I'm going to call you at the end of the day. Or here's my cell phone. Just text me when you want to talk and let's do that. One of the doctors I interviewed said she would rather talk to her patients once a week. Just talk to them on the telephone because it's easier for all of them to have a nice human communication and keep moving the ball forward. Treat your doctor like they are your partner in your healthcare. They want to be. And there's all these barriers to them being that because they're managed from above just as much as you are.
I never really thought about asking my doctor, how would you like me to communicate? Now,
Nobody does.
I've never gone through a huge life event, but I'm dealing with things with my siblings and I are dealing with healthcare with our parents.
Sure.
That's such a great question, whether it's my healthcare journey or if I'm on team Rebecca
Yeah.
and helping you. That's powerful. And I
Yeah.
never thought about that. And I
Yeah.
wonder, I'm sure
That's what my book is full of. It's stuff that we never think about these things because we're stressed.
right.
And in that hot moment when you're stressed, you don't go, gee, I should ask this doctor a human question because they're a human, because you don't see them like that. You see them as this authority figure who's here to give you the bad news,
Right.
and you're just about it, right? But that was something, that's why I spoke to as many doctors as I did, because I really thought it was important to get their side of the story. Demonizing doctors is not going to help us get better healthcare. And, it's easy to do that because our system is set up in this very kind of cold, almost adversarial way. And it really isn't. It's really a partnership. It's just there's a lot of pressures. So we're all in it together. And, women doctors are incredible leaders. And often they defy the mechanization and just do what they know is right.
But I think as women, we always are ones to be able to take it in, and then we might ask, and then we miss that opportunity because we don't want to impose. So when it
Yeah,
comes to our health, what I'm hearing is, in the most polite way, I need to impose myself into my healthcare journey and ask these questions so
yeah,
that I can, when I retire, have my health as part of my wealth and enjoy my go-go years and not worry about my being sick.
absolutely. And I want to jump on something else you just said. You intuitively realize that it is important to ask all the questions. And, I have coached so many women on this. Yes, you should write down all your questions. Yes, you should bring a friend if they're willing and sign whatever HIPAA papers you have to, because you freeze in the moment.
Mhm.
And third of all, never hesitate to ask those questions. This is your body. This is your health. This is your journey. You're not annoying. As I said recently in an Instagram video I made, you're not annoying. The system is annoying. Women are so worried about how we come off. We're so afraid to to assert ourselves. This is the most important thing in your life. As you said, your health is your wealth. If you don't have it, you got nothing,
We
right?
only have one body. It's not like I can go to the store and buy something and put it on and be different. This
Yeah,
is the one body I've been given. We only get an opportunity to live X amount of years. So why not advocate for ourselves?
absolutely. And there are no stupid questions and there are no annoying questions. Ask them all.
Well, challenge accepted. I'm pretty sure I can ask a few, but that's just me and my weird personality. Another aspect of your book, though, is helping women manage their own feelings because it's overwhelming. You're going to go through a gamut of emotions: anger, sadness, depression. You just might not know how to navigate all of it. So add on the stress of the healthcare system and the broken pieces of it. What advice do you have for women to help them stay grounded on their journey? Because in my head, I'm like, if I had X diagnosis in my head, because it's not happening, I think I could be Superwoman. But in reality, I would probably be in the corner crying.
So I'm really glad you asked me this question because, again, I have a developed point of view from watching, from coaching, from listening to so many women. And here's what I want to say. You got to be mindful about mindfulness. We've got this good vibes train and it can run you over when you're dealing with a health journey. People say things like blah blah blah, meant to be, manifestation, etc., etc. When you're dealing with a diagnosis, that can be so lonely and so difficult. It could leave you feeling on the outside. You got to really think about what mindfulness means. And what it means is staying in the moment. It doesn't mean be toxic positive. Toxic positivity is really dangerous to women when they're on a health journey. And, unfortunately, our soundbite social media culture bombards us with those kinds of messages. There's not enough time to get deep. So it's just good vibes only,
Mhm.
hashtag this, hashtag that, right? And this is deeper than a hashtag. So, what I recommend for women is really think about who you surround yourself with. Who are your gurus, your go-tos on mindfulness? Because this is a very bespoke journey you're on. So go to disease-specific organizations. Look at what science has to say about mindfulness. It has a lot of good things to say. There are things that really do work, right? Like guided imagery, meditation, creativity as outlets for the feelings that you're having. All of these things do work, but be careful, be thoughtful. Like I said, it's a little meta, but be mindful about mindfulness.
Would you also say that mindfulness is instilling your boundaries and holding to them? Because when you talk about don't be toxic positivity, because then people probably aren't going to give you the support that you need, but it's also making sure that says, XYZ, I love you, but right now I have to focus on this. When I'm in a different place, let's connect. And I think women have a
Absolutely.
hard time doing that because, one, we don't want to appear weak. We don't want to show that we're going through something, but we also have to take care of ourselves. My mom always, or my sister used to always say, I only have a bucket. It only has this much space. If you continue to take from it, but don't fill from it, I can't give anything. So it's being mindful of where your bucket really is in your journey.
Oh, absolutely. And, guardrails, boundaries, they matter so much, right? Like the way I describe it is when I talk about the drafting of your team that I talked about earlier, you need somebody to run the point, answer the doorbell, sort of screen the calls a little bit,
Yeah.
because there can be times when people go too far, people say too much. Sometimes you think speaking to somebody who went through the same thing as you went through is going to be helpful. And then it turns out they've got a little narcissism and it make it all about them.
Right.
And they need you to do what they did because they want validation. Those are all moments where, yeah, you need those boundaries, you need those guardrails. And I do take that back to having a trusted soul run the point for you.
Have your own point guard.
Yes, I'm a basketball fan and a former player, so that works for me.
Well, it's important. Again, it's building your squad and making sure you have the right people in the right seats to support you while you go through this. And that way, and not all journeys are the same. I think that's where, like, when you go online and you try to read and research, you think, oh, my journey is going to be like this, and it veers off a different way. So I love the fact that you're talking about build your team, set your boundaries, be mindful, because this is your journey. This is
Yeah.
your health. You need to navigate to get across that finish line. So
Yes.
powerful.
You just
I-
said something that made me want to add another tip, by the way. You've got to be so careful with the internet. The internet is full of information, but it doesn't know you. It will serve you stuff as if it knows you based on what you ask it, but you will read things that sound reasonable,
Mhm.
well written, optimized for search engines for sure, but it might not apply to you the way you think it does. So you have to protect yourself. That's another way, get your lawyer or your editor friend or whoever is the most critical reader, let them read that stuff. And maybe let them read your initial reports before your doctor tells you stuff as well, because you are going to freak out and go off the deep end before you know what really applies to you. And that's really hard, right? Because you're not a statistic. We all live by these statistics, they all affect us. But it's so important to just hold back and wait a little bit until you understand what your facts are.
And I will say it's okay sometimes to go off the deep end as long as you have that person to hold your hand to ground you.
Well,
It's
sure.
hard
Yeah.
not to. It's very
Yeah.
difficult.
Just don't do it alone.
Right. Have your spouse, your best friend. I have
Yeah.
a friend who's a CMO for a medical device company. She's a doctor. I've reached out to her on things and she's like, simmer down, Kirsten.
Yeah. Yeah.
Okay.
That's exactly what you need. Somebody who can just stay in the middle when you can't.
And only a few people in my life can tell me to simmer down without getting the look. But
Can I see the look? Wow. That's a deep stare.
oh goodness, I'm having too much fun on a serious conversation, but I love the content. This is such great information for women and men too.
Yeah.
So those being holistic financial advisors make sure to account for things as long-term care planning for their clients, different forms of health insurance. And we talk about, even lifestyle planning for women when we look at their retirement plans.
Yeah.
How can we make sure that our financial advisors, the ladies of C2P and the ladies out there in the field, are doing the same for themselves? Because at the end of the day, we will take care of everybody else and turn around and go, oops, I didn't have that in place for myself.
Yeah. Well, it's what you said before, right? This idea that women do tend to put other people first.
Mm-hmm.
Well, what I'm arguing in my book and in my life and, sort of my goals and my professional purpose at this point is to say to women, when it comes to your health, you must put yourself first. Even if it's for 10 minutes of a day. It doesn't have to be all day. Just in terms of thinking and planning. And, financial planners and people who transact with companies that sell products that help people plan are in a great position to think about that, because you do it for everybody else. Now take 5 minutes, 10 minutes every day and think about how you can plan for your own wellness, your own health. It's so important. And if it's the thing you hear on the airplane about the oxygen mask,
Put
right?
your oxygen mask on first.
Just put it on first, and then you can breathe. And once you can breathe, then you can be yourself and help everybody else.
What else can we do as financial advisors for our female clients? Do you have any other? We're going to put our oxygen masks on first. I will continue to use that phrase because that is perfect for us to make sure we're taking care of ourselves. But as we're doing that and we're also meeting with our clients, what more can we do to help our female clients?
So because you guys have relationships with entities that sell various benefits to people, in a lot of ways, you have more sway with them than your clients do. So you can help, you can advocate. An example would be, let's move it to the workplace. Let's say I'm having trouble talking to my life insurance company about the fact that I have a disability and I'd like to either freeze my premiums, or maybe there's a benefit available to me because of it. They might not listen to me because I'm just the individual. But you guys make contracts with them all the time. You actually probably have better sway with them than I do as an individual. Be willing to step up and help. That's a great thing that you guys could do. Employers have the same thing with the health insurance plans that they're the ones who are the parties to that contract, right? They're the ones who really pave the way for those relationships to happen. So if they are willing to help call on your behalf and say, hey, can you really advocate for this person? Can you really help this one individual? They might listen more than just the one individual all alone in the world asking for that help.
So we're holistic planners. We provide holistic planning. We talk about time segmented money. We help them with their life insurance needs to make sure they have living benefits.
Right.
So we just don't want to just be their financial advisor and planner. We want to be a trusted advisor. So when they call and they say, hey, Kirsten, I was diagnosed with XYZ. What do I have to help me? I can say, I'm so glad you asked. Let's get your claims form. Let's get you taken care of.
Right. And also you have access to the vendors who sold you those plans in a more powerful way than one individual does. So you can help with those communications and just create a circle of help when somebody needs it.
Especially when we advocate for lifestyle planning for women, helping them empower themselves to be financially independent when they get retired. We can be an awesome resource for them when they need a trusted contact in their squad to help them navigate their health journey.
Yeah. And that's why I'm excited to be talking to you, because it isn't just health insurance. Benefits are really holistic these days. It's really a 360 thing. And it's like I said before, we're recreating or creating from scratch, you could argue, a safety net for people. And we can't pretend that money has nothing to do with that, because of course it does. And so if you think about what you do all day, you are trying to give people a runway so that they can feel safe and they can have freedom and they can enjoy their health, their life, their time, all those things, right? We're all working together.
That's why I love this industry, is because every day I get the opportunity to help somebody meet their goals and help them if a situation like this arises. We're here to support, not only get them into retirement, to support them in the lifestyle that
Yeah.
they're looking to have. So that's so powerful. We are coming up towards the end of our time together. Do you want to share a little bit more about where your book can be found and any final tips that you'd love to leave the audience with before we end our time together?
Yeah, thank you. So I'm on Instagram at When Women Get Sick. I have a website, www.whenwomengetsick.com. Glad to have that URL. That was lucky. And I am available to anybody. I will help anybody for free because that's how serious I am about this. My book is coming out, as you know, on July 29th, and my goal is to get it in the hands of as many women who need it. And I will hustle. I will talk to anybody. I will come on any Zoom. Like I said, I will help anybody individually or in groups in service of this mission and this purpose. So, last minute tips, really, honestly, it's on all of us to take care of one another. And that might sound like a really big challenge, but the good news is, as we discussed today, we have the tools.
You just gave me goosebumps. Rebecca, I am so grateful to have gotten this opportunity to chat with you. I look forward to reading your book. And ladies and gentlemen who are listening, she means it when she says, if you've got questions, reach out. She is a phenomenal resource. Don't hesitate. Create your squad. Let us know how we can support you. And again, Rebecca, thank you.
Thank you so much. This was such a lovely conversation.
Thanks for tuning in. This podcast was brought to you by C2P, an organization whose purpose is to educate, train, grow, and support holistic financial advisors so families can achieve true prosperity. Never miss an episode by subscribing now to discover new resources and strategies. Visit c2penterprises.com to learn how we can help scale and secure your business. At the time of delivery and any subsequent publishing, information was deemed reliable, but is subject to change by the time of listening or viewing. The contents of this piece include options and projections of C2P, are subject to change, and are for informational purposes only. The information provided in this presentation is not intended to be individual investment, tax, or legal advice.